Well, is there any news going on with us right now?
Well, I'm in grad school, which is cool. Teaching. I'm pregnant.
Wherever we go,
Whatever we do,
you'll have me,
and I'll have you. Together,
or not at all.
always, and
always.
So the biggest thing that's been going on for us over the last few months, I guess, is we did our first IVF cycle. The first time that we conceived, we miscarried, and then 2 years ago,
I had a ruptured ectopic pregnancy that resulted in emergency surgery and the removal of my right fallopian tube and draining some blood out of my abdomen that was bleeding. So 3 days before Christmas.
yeah. So we've had some trouble, and since that point, just didn't have any luck trying. So we decided to go through IVF, which was eye-opening. It's a very involved, a very intense kind of process. Let's talk about the IVF process.
So we had two choices. We could have done IVF, which is what we did choose, or we could have gone with IUI. So IUI is as close to a natural pregnancy as you can get with help. Like, you're still getting help. So basically what they'll do is they'll put you on a medication, usually Clomid. If you've ever heard somebody talk about taking Clomid, what it does is have you ovulate more eggs with the hope that when they basically artificially inseminate you, that at least one of them at that point will be a viable egg, so then it will be fertilized. With IUI, there's really, really high risk of multiples, and the success rate is not as good as IVF. So we opted to do IVF, which is where they take stimulation drugs, shots for my ovaries.
What was it? 1 in the morning, 2 in the evening, for 2 weeks, 2.5 weeks, 3 weeks or something.
Everybody! Injections themselves, I think there's a pretty common misconception about those. The needles that I was using are like diabetic testing, like blood needles, whatever you call those. The scariest thing for me for the injections was one of the medicines. I had to mix myself every night, and I was so scared that I was going to mess up the dosage. And then after 5 days of being on that, then they changed my dosage, so then I was reteaching myself how to mix it, and granted the second dose was way easier to do than the first one, but it was still really scary for me personally that I was gonna mess it up. I was so scared that I was gonna do something wrong. While they are doing stimulation shots, I have to go in either every 3 days, every 2 days, or every day to have an ultrasound. So you're in there a lot. It only takes a few minutes, but it was a little bit frustrating for me as far as having to be late for work or miss part of the day in order to make it to these appointments as often.
There's just so much on the woman. There was so much on Shay that she had to do with all these injections and medications, and just being so alert and attentive to every single step of the process. My job was easy. We don't have to go there, but my job was easy. I just brought him something, and that was it. She was poked and prodded, and on her own accord, and many times at the doctor's office, and it takes a lot.
And then they grow as many eggs and follicles as they possibly can, and then they'll go in and they harvest them. So that's technically considered surgery because I have to be put under for that. We had a lot of eggs that we were able to have harvested. We had 30 that came out. Of that, 8 of them.
8
were actually fertilized then in a lab. And of those, only 6 of them were fertilizing at a rate that they were happy with. And then by the point we got to my transfer day, which is where they put one back into me, only one of them was the stage that they would have liked, where they felt comfortable only transferring one egg, which is cool because if it hadn't gotten to that stage, then we probably would have had to transfer more than one, which ups our chance then of having multiple. And then if there were any viable eggs after that, then they would freeze them, so should we ever choose to go through that process again, we would have had the ability to just take the frozen embryo. Sorry. However, none of our other eggs got to that point, so we have no frozen ones. After they harvest eggs, then you have to wait 5 days until transfer, and then after the transfer day, then you have to wait 2 weeks, which after being in a doctor's office every day, waiting 2 weeks to find out if it's taken, if you're actually pregnant, is really long, 2 weeks.
And to go back, I guess, so Shay had done some consultations. She had discussions with the nurses, doctors at Shady Grove prior to me kind of coming on board. So she had done the preliminary conversations and felt out a little bit for what the process would be like. And then when I came and they kind of presented both the IUI track and the IVF track, I left and I knew that I should have felt excited about it because this was our chance to get pregnant and to have a child, but I left feeling so damn overwhelmed at everything that was involved because it is such a predetermined, defined, precise, everything is mapped out and there's just so much and you have to do this at this time and this at this time and on this day, 5 days later this, and then, there's so many check-ins and there's so many medications and there's so many things that are involved to it that as I'm sitting there and just getting all of this at once, I'm like, man, it just takes like all of the wonder out of it. That was my initial reaction. And I knew that, okay, once we get to that point and, fingers crossed, once we got to the point of conception and pregnancy and doing that I would look back and I knew that I would understand that it was really cool what is possible through it, but it's also just so
Scientific.
very scientific.
Really scientific.
And it's hard to be like, yeah, it's because it does strip out a lot of that naturalness and wonder, like I said, out of the process. But it's worth it. It's worth it because we're pregnant.
Yay!
It worked for us. The first cycle worked for us. So we found out the day after Thanksgiving that we got that phone call that we were pregnant. And I think we both prepared ourselves for us to be told that no, we weren't.
Yeah.
That when the phone call came, otherwise it was pretty cool. I jumped up and down and she started crying and it was like I said, looking back on everything, all the steps and everything that you have to do, I feel for anybody that has gone through that one time alone, let alone 3-4 more times than that, who has gone through that process and everything involved, and then it doesn't work for them. That would crush. It would have crushed us because it's like reset, and you have to do all of that over. It's a process of 2 months, 3 months, and emotionally, mentally, you wouldn't want to just jump right back into it. Like, okay, next cycle, here we go. It's a lot, and so for us to have that fortune, I guess, on the first time, it was fantastic. So we're loving it. We're so excited because we like to talk about it, and we hope that if anybody else is considering it or has gone through it or whatever,
Please
that
talk to us.
we're people that you can talk to about it, or just confirmation that other people have gone through it and we
And
know.
good resources. We're just, the clinics that we went to, Shady Grove Fertility, which I think they're technically an international fertility clinic, they're amazing. Obviously they're not everywhere, but I couldn't say enough about our experience there. They have been incredible. My nurse, even after I graduated, is what they called it. So I was done at the actual fertility clinic and moved on to a regular OB. My nurse called me and was still checking on me and seeing how I was and how I was feeling. And anytime I told her any symptom whatsoever, and she would listen to me very carefully and tell me, nope, that's nothing, that's totally normal, you are okay, or if that feels like it's more concerning, here are some steps you can take. We can get you in for an extra ultrasound if you need to be looked at, if you're really that concerned about it. Like, they were wonderful. I cannot say enough for our experience there.
No, we had a great experience. It was, I'm sure anybody that has successful fertility treatments anywhere that they go, we'll rave about it. Shady Grove was great for us.
Yeah.
And there was a lot of, it's just great work. I think regardless of where you go, I bet that's got to be a very rewarding place to work. And, all right. We'll check in, like I said, as the bump grows, and as we get a little bit further along, as we have more things to share, we'll check in. So, congratulations, us! Yay! Love you all.
Bye.